I would say that all of the therapists here have genuine concern and compassion for the patients. And that goes not just for the therapy department, but for the nurses and the doctors as well.
So one thing I really love about physical therapy is, so it's a partnership. So we have the part that we as therapists do, and then also what the patient does. And so we teach patients what they can do to help themselves at home, what they can do to avoid things that's causing their symptoms to worsen or causing their condition to get worse. So a lot of it's education and helping people, setting people up to have success while they're in therapy and then kind of throughout the future, so they can keep doing what we have them do and doing things that'll help them get better. And then we do a lot of so teaching exercises and correct movements, posture, things like that. We also do a lot of manual therapy, just getting joints stretched out, getting joints moving. And it all these things combined is what helps people have the most success.
I used to do a lot of running, and so just over the years, 40 some odd years of physical fitness and stuff like that, I had some issues with some arthritis. And so my cartilage wore away on this knee, and apparently had some bone-on-bone contact. So I had to go in and get a partial knee replacement.
We have a patient that comes in for surgery, an inpatient. We're going to be seeing them upstairs, and then as they transition, maybe even into their skilled rehab center for continued care. And then they also come to our outpatient rehab center. So there's a line that tracks them from the very beginning of their care until the time that we have actually discharged them and got them back into the community doing what they love.
We see what they can do, whether it's a little or a lot, and then make decisions from there about what they might need for home.
The thing I notice the most is it's a smaller community, and so you get a lot of patients in here that they'll even know each other, or they'll even know some of the people who work in the hospital. And so really you can connect with them in a personal level that way. You almost feel kind of like family in a sense.
These guys seem to know what they're doing. They've done a good job for me.
We're very fortunate to have our doctors right across the street. We get to go over and speak with the doctor face to face anytime we have a question about a patient or have a concern about a patient, rather than a phone call or a fax or a note. We have the opportunity to go over and speak with them face to face, and I think it makes our patient care a little more personable.
On September 26th of last year, I was in a burn or fire at my house from combustion and fumes in a garage. I had spilled a lot of gas, not intentionally. I wasn't paying attention. I was watching my goats instead of watching what I was doing to the lawnmower, and I spilled a lot of gas, like 2.5 gallons, and it spread on the concrete. And I went and mowed my yard, came back, filled it up again, went and finished, and when I put the lawnmower in there was nothing wet on the concrete. So I just stuck right there and shut the door. It has no power back there, no ventilation, so it combusted all day, through the heat of the day, all night. And when we got home, me and my husband had went on a date. When we got home, the goats wanted to eat. I have neighbors on both sides, so we're gonna give them food. So I went to go through the side door to open the overhead so he could feed them. And like I said, there's no power back there, and I had a hold of the handle, and I had a lighter in my hand, so I had some kind of light to pass me because we had a lot of hay in there. So as I opened that door and I sparked that lighter, I sparked as well. So I got it's like almost 39% of my body burn. It's both my arms, my neck, and from my chest up. So I did lose half my breast on both sides. Because I am Native American, they have a tougher time with scars. And so there's a lot of times my scars that are a year old, they still try to tighten up, and so I shrink up, and I can't stay like that. Otherwise, the day I try to go straight or bend normal, it could rip. And where my skin is all delicate now, it'll never toughen up like normal. It is my skin, but it won't be normal anymore. It's really thin, and so it will cut, and you can get lots of infections. So
I love it when a patient comes to see me 6 months to a year later and says, "Look at what you did for me. Look at what you helped me get back to. I'm riding my bike, I'm skiing, I'm playing basketball. You helped me and I got my life back."
this is like my family. We decided we were going to put myself a bed in the corner. Yeah, to me, I consider this you know, a lot of people have a job that they love to go to. A lot of people have a job that they hate to go to. To me, because I come 4 times a week to PT, and on 2 of those days I do OT. So really I have 6 visits in the week. And I love coming to this job. To me, it's a job because I like the atmosphere. Everybody always greets you, not only, you know, the therapist and the OT, but the patients too.
I work with some of the most amazing therapists, genuine, caring, loving. We laugh a lot and we cry a lot, and everybody works really hard for their patients and for each other.